This is everything you need to know about the COVID-19 surge happening right now in the summer of 2026, 6 years after this virus first changed the world. If you thought COVID was something we didn't need to think about anymore, the newest CDC data says otherwise, and I want to walk you through exactly what's happening, where and why. Let's start with the numbers because they tell a clear story. As of July 22, 2026, the CDC estimates that COVID-19 infections are growing or likely growing in 37 states. 0 states are declining. Only 11 states are holding steady. To put that in perspective, just 1 week earlier, on July 15th, only 18 states showed growing infections. That means in the span of about a week, the number of states seeing rising COVID transmission roughly doubled. This is not a slow drift. This is a sharp, fast-moving trend line. So what's actually driving this? Part of the answer is a specific subvariant. A strain called NB.1.8.1, nicknamed Nimbus, is now the dominant version of COVID-19 circulating in the United States, responsible for roughly 43% of all cases as of late June. Nimbus isn't some entirely new virus we've never seen before. It's part of the same Omicron lineage that's been mutating and cycling through the population for years now. But dominance matters because when one strain becomes the majority strain, it tells us that's the version currently best at spreading, whether through slightly different transmissibility or its ability to get around some existing immunity. Here's where it gets specific to where you live. Multiple states in the South and West are experiencing a real uptick in transmission right now, with wastewater surveillance reporting high or very high viral levels in those regions specifically. Wastewater testing has become one of the most reliable early warning systems we have for COVID because it captures viral presence in a community before people even show symptoms or get tested. If your wastewater levels are climbing, transmission is almost certainly climbing too, even if it hasn't shown up in official case counts yet. The CDC's own most recent report backs this up. As of July 24th, the agency describes national COVID activity as low and stable overall, but says it is beginning to show early signs of an increase. And critically, their scenario modeling specifically points to the South and West as the regions expected to see COVID increases through the summer months, precisely because those areas did not experience much COVID activity during this past winter. In plain terms, if a region did not get hit hard over the winter, it is now considered due for a summer wave instead. That is the pattern the CDC's own modeling is anticipating, and it appears to be exactly what is unfolding right now. Now let's talk about what this actually means in terms of human cost, because case counts alone don't tell the full story. In the 4 weeks ending June 28th, the World Health Organization recorded 168 COVID-19 deaths worldwide. Of those, 143 were here in the United States. Read that again. The United States accounted for the overwhelming majority, roughly 85%, of all COVID deaths reported globally in that entire 4-week window. That's a striking imbalance, and it's worth sitting with for a moment. This is not ancient history. This is happening in real time, right now, in the country you live in. It is also worth understanding that COVID's toll is not limited to acute illness and death. Long COVID remains a significant ongoing burden years into this pandemic. Health systems in other countries are still actively funding long COVID treatment centers because the condition continues to affect hundreds of thousands of people with lasting, sometimes severe, limitations on daily life. This is a virus that, for a meaningful subset of people, does not simply resolve after the acute infection ends. So what should you actually do with this information? First, don't panic, but don't dismiss it either. This is a real, measurable summer surge, not speculation. If you're in the South or West specifically, this is the moment to be a little more cautious, particularly if you're elderly, immunocompromised, or caring for someone who is. Testing is still available and still useful, especially if you're symptomatic and want to avoid spreading it to someone vulnerable. Updated vaccines remain the most effective tool we have against severe illness and death, so if it's been a while since your last dose, this is a reasonable moment to check with your doctor about whether you're due for an update. Basic tools still work here too. Ventilation, masking in crowded indoor settings if you're at higher risk, and simply staying home when you're sick all continue to reduce transmission, even years into living alongside this virus. COVID-19 didn't go away. It just became something we stopped watching as closely. But the data doesn't stop just because our attention did, and right now that data is telling us clearly that this virus is finding new momentum across more than 2/3 of the country. Staying informed isn't fear-mongering. It's exactly how you protect the people you love. If this kept you actually informed instead of just scared, hit that like button and subscribe, because I'll keep tracking the real data behind the headlines so you don't have to dig through it yourself. There's always more happening beneath the surface than the news cycle lets on, so stick around for the next one.